In the starting position for a field hockey flick, also known as the pre-contact phase, the flicker is low to the ground to generate as much force as possible. Rectus femoris and the sartorius muscles from the anterior thigh region are contracting eccentrically to create flexion at the hip at a 35-degree angle. The biceps femoris, semimembranosus and semitendinosus are contracting in an eccentric manner to produce knee flexion at 45 degrees. The tensor fasciae lata is also creating hip flexion. In the post-contact phase, or the follow-through phase, the rectus femoris and sartorius contract eccentrically to produce flexion at the hip. The biceps femoris, semimembranosus, and semitendinosus also contract eccentrically to produce knee flexion. The tensor fasciae latae, gluteus medius, gluteus minimus, pectineus, and gracilis all also create medial hip rotation. In the post-contact phase, the follow-through leads to the concentric contraction of the gastrocnemius, in which both heads produce knee flexion and ankle plantar flexion.
For the upper limb, it consists of 4 parts: the shoulder, elbow, forearm, and hand regions. Firstly, for the shoulder region, it involves the scapula, humerus, and clavicle, as the ball and socket joint between the glenoid cavity of the scapula and the head of the humerus allow the movement of the shoulder to abduct and adduct from the body to generate power in the hip. Now, the muscles being used involve the muscles of the trapezius, latissimus dorsi, deltoid, and rhomboid major, as well as the rotator cuff muscles, which include the infraspinatus, subscapularis, and supraspinatus. These all work together to allow the rotation of the scapula and assist in the abduction of the glenohumeral joint. Now, for the elbow region, it only uses the biceps branchi and brachialis, as this allows for elbow flexion to occur at the hinge joint of the humerus, ulna, and radius. For the forearm region, the anterior muscles involved are the flexor carpi ulnaris, the flexor carpi radialis, and flexor digitorum profundus, while on the posterior forearm, the extensor carpi radialis longus and brachioradialis are used. These help with wrist flexion and extension, as well as providing some elbow flexion too. Lastly, for the hand, all these muscles are used for the flexion of the fingers as you grip the hockey stick throughout the whole action, particularly the adductor digiti minimi, flexor digiti minimi brevis, adductor pollicis brevis, flexor pollicis brevis, and opponus digiti minimi are all being used to provide this flexion throughout the action.
In pre-contact, there is a need for an influx of air to help hit the ball with maximum force. So within the trunk wall, there are true muscles called the external and internal intercostals. External intercostal and the internal intercostal interchondral both help elevate the ribs during inspiration. However, the primary muscle of inspiration is the diaphragm, and the diaphragm's main function is to increase the vertical dimension of the thorax. In the abdominal wall, there are anterior lateral muscles. During the pre-contact period, the rectus abdominis concentrically contracts, which is essential to enable stable trunk flexion. There are intrinsic deep muscles, the rectus spinae muscles, iliocostalis, longissimus, and spinalis, which work bilaterally and contract eccentrically to enable the neck to extend. In post-contact, there is a contralateral rotation and contraction of the external oblique, while the internal oblique is undergoing an ipsilateral contraction. Within the superficial level of the back, the splenius, capitis, and cervicis act unilaterally. They both laterally flex and ipsilaterally rotate. In the intermediate level, the rectus spinae groups still work bilaterally but are contracting concentrically instead.
The semispinalis shortens, contracting concentrically, producing contralateral rotation of the cervical region. The multifidus shortens, contracting isometrically, allowing for stabilization of the vertebrae during movements of the vertebral column. Interspinalis and intertransversari contract isometrically to stabilize the vertebrae. They also concentrically contract to produce slight lateral flexion of the vertebral column. The sternocleidomastoid concentrically contracts to allow for contralateral rotation of the cervical region. The anterior scalene concentrically contracts to produce slight flexion of the head. The rectus capitis lateralis contracts isometrically to stabilize the atlanto-occipital joint. The rectus capitis anterior contracts concentrically to produce slight head flexion at the atlanto-occipital joint. The longus colli produces slight neck flexion by contracting concentrically. The semispinalis eccentrically contracts to produce extension of the vertebral column. The multifidus isometrically contracts to stabilize the vertebrae during movements of the vertebral column. Intraspinalis and intertransversari isometrically contract to stabilize the vertebrae. The rotators contract eccentrically to bilaterally extend the thoracic spine. Sternocleidomastoid eccentrically contracts to produce extension of the neck and head. The rectus capitis lateralis isometrically contracts to stabilize the atlanto-occipital joint.